Good morning, everyone. Hi, this is Aishwarya from Altem Technologies, and thank you for joining us on this session. I will be taking and talking about the topic 3D bioprinting in skin. And before we do that, I will recap on the previous session that we had. So, our previous sessions using 3D bioprinting as a technique as well as how it is used these days in precision medicine. And the following set of sessions are going to be different with time, in terms of applications, in terms of ideas, in terms of processes used in printing. So, let's dive in. I will share my screen right now. All right. So, the topic for today is 3D bioprinting skin tissue models. And I'll just introduce myself. I'm Aishwarya Shroor. I'm a technical specialist here at Altem Technologies. And so, Technologies is in association with Cellink. So, I'll give you a quick recap, a quick review of what our company is, what is it that we do, and then we'll dive in right to the topic. So, what us, we are a 3D innovation platform company, and we work with Dassault systems for 3D design, MSC software for CFD models, simulation models, and then we have Stratasys for plastic 3D printers, Artec 3D for 3D scanners, and then Dassault systems, BioVia for life science simulations, maybe Discovery Studio, Material Studios, and Pipeline Pilot. And then we also have Cellink, which is for 3D bioprinters. So they have quite a variety of bioprinters within them, say extrusion based or DLP based, and then you have simple models, you have complex models, industrial grade models. So we have those categories of machines. We actually started in sometime 2011, and since then we've been setting our foot and gaining recognition in the industry and growing with time. And we have our customers who are from various sectors, maybe education and research, aero and defense, automotive suppliers, healthcare, IT services, consumer products, automotive OEMs, and obviously life sciences, in terms of using Dassault systems by OVIA as well as using this. Um, we are a growing we have a growing set of clients, and we work with multiple sorts of people. And I'm sure people in this webinar might be from maybe the life sciences background, but if you see that there are people who could take interest in few of our products, understand us, you can definitely come, have a look, and visit our website, our link files, our Twitter profiles, every social media handle. So we keep conducting webinars and seminars and events throughout, to educate people, to create an awareness among people. So now I'll dive in. So when we talk of the challenges in life sciences, it's actually, when you look at it, it is the lack of organ transplants being one point. Following that, there is a waste due to wrong testing methods, and the lab to shelf time is a problem. So the waste due to wrong testing methods would be a problem, stating, whenever there is any sort of drug developed, any sort of implants or anything which is being developed in the field of healthcare itself, they are all tested on mammals. And yes, they are useful, but there is definitely a little bit of gap when it comes to it being used for humans. Lack of a very big problem, a very big, solvable. One is there is no enough transplants, no enough organs, enough donors. Even if you get a donor, then you will probably have some sort of rejection. So from there, you also come down to the lab to shelf time, and from the lab to shelf time, you will see that there is this sort of time lapse or time gap um, between having these products and having them as a generic over-the-counter medications or any sort of medicine available to the patients. So now I'll come in and tell you about the necessity of skin fabrication. So talking about skin fabrication, um, it is basically with the idea that right now whatever cosmeceuticals, pharmaceutical products, just a second. Yes. So, whatever cosmeceuticals and pharmaceutical products that you see at this moment, they are in the form of, say, one second. Yeah, they are in forms where you will have to take the testing, maybe animal testing or any sort of other testing that needs to be done. And at this moment or over time, it has come to a conclusion that testing has been banned in most of the countries. So, because animal testing is banned in terms of cosmeceutics or even basic pharmaceutical, there is a need for a sort of replacement. Another point being we need drug screening, we need cosmetic testing. There is xenograph, causing any sort of immunological effect. So when you use any sort of xenograph, you would have to consider the comorbidity, the kind of side effect that might happen if you use a xenograph. Following this, you would have human studies, right, which would show safety and efficacy before clinical trials. You have to put a product out in the market, and in that process, it's quite possible that you might not be able to deliver, you might not be able to even come through the clinical phase or preclinical phases to get to the point. So, if you're talking about skin fabrication as such, you could use, say, any sort of platform, an artificial fabricated platform for drug studies, for pharmaceutical studies. Then you have something called disease modeling. If you want to look at, say, wound healing, you want to look at grafts, you want to look at how you want to test your drug against a certain issue, against a certain disease, then you can create these artificial disease models and test your drugs and in fact create drugs, or allows this whole process entirely allows in your drug development, drug screening, drug toxicology studies. And then comes the clinical application saying, okay, if there is a scenario of grafts in case of wound issues, in terms of cosmetics issues, you would require something as an applicant, as an artificial skin that can be used in these clinical applications. So that's how you could use, these artificial fabricated skin for the use again for end users and for clinical applications, for research purpose, for any facet that you would see when it comes to product development or even in terms of healthcare problems, right? So I will come down to what is the anatomy of skin. So when you look at the anatomy of skin, we know that skin is the body's largest organ. It has this function of being a protective barrier against, say, mechanical, thermal and physical injuries. They prevent any sort of loss. In case of immunity, it detects an infection quite easily because it is a first line of barrier for us. It regulates the temperature. And when you talk of skin tissue engineering, right? So its aim is to reconstruct the structural and the functional components of the skin. So reducing any sort of scar formation and maybe improving the quality of wound healing. Coming down to the structure, the anatomy of skin. So when you look at skin, you have your glands, maybe sebaceous and eccrine glands. So you would go, and when you look at the broader differentiation between this, you have maybe the epidermis, the dermis, and the hypodermis. In the epidermis, you have stratum corneum, stratum lucidium, stratum granulosum, right? And then you go on down further to the dermis, where you have papillary and reticular dermis, and you also have the hypodermis. So when you talk of the epidermis, that becomes the first layer or the first section which contributes to the protection of the body in terms of most of these functions. Following those, below that, you again have the dermis, where you have maybe your hair follicles, you have your mast cells, you have your other forms of cells, say Merkel cells or Langerhans cells. All of these cells are available there, and below that comes the hypodermis. So the hypodermis itself, you will see maybe the adipocyte. So the hypodermis is a layer which is rich in fat, rich in vasculature, rich in terms of locating the follicles, locating the nerves, locating all the crucial organs. And below, obviously, the hypodermis is the skeletal structure. So we are now dealing with just that first top layer that is essential. That is skin, right? So when you talk of skin and the anatomy of skin, so each layer of skin actually consists of different cell types, and they have distinct functionality. So when you talk about, say, the epidermis, right? So the epidermis, being the topmost layer, consists of several layers among it, and it consists of a primary cell type, which is the keratinocyte. So the function of keratinocytes is actually to ensure that there is a surface barrier for the greater skin construct. So this keratinocyte helps in the epithelialization of wound healing. Then comes melanocytes. Melanocytes provide pigmentation to skin and allow any sort of UV protection. Then you have the Langerhans cells, which are immune response cells for allergen response, and they're the first line of pathogen defense. Following that, you have Merkel cells, which are the light touch mechanoreceptors. So they're more directly connected to the nerve cells or the nerve structures. So looking at the histopathological structure, you will see that you will have stratum corneum, stratum lucidium, stratum granulosum, and spinosum, and basal, and then you have the dermis. So the keratinocyte growth and the migration usually goes below from this stem cell. In terms of our organogenesis factors, you would go having the stem cells, and you will have the major progenitor cells, which will go on building over and over and over and over, making a difference in, you can say, the arrangement of the cells, the keratinocyte arrangement, the shapes of the cells, the kind of texture of the cells, and what is the arrangement. Basically, arrangement is a very important factor to consider. So either they are loosely packed or tightly packed, or they're arranged one next to the other or layer by layer. So all of this kind of depends over there. Then you have the dermis layer. So the dermis layer again consists of the main structure, which is the fibroblast, and this provides the cell signals for keratinocytes. So they are the ones which are the main factors in connecting most of the structures. So they provide the cell signaling. They produce the ECM, which is essential for the skin integrity and the function. So when you talk about our skin, we have predominant structures like filaggrin, collagen, any other sort of biochemicals which are very essential in terms of forming the ECM as well as creating a structure. Then you have endothelial cells, which is for the blood vessel network throughout the dermal layer. And in that, you have these blood vessel networks which are uh, throughout the dermal layers, and they help in, again, connection, since blood vessels are quite essential. And these blood vessels are obviously providing the nutrients for the rest of the layers, and they hold a very important place. And in the dermis, you also have other structures like hair follicles, eccrine glands, sebaceous glands, and these are complex structures, complex forms to achieve when you try to replicate them. So this is just an image of how you have your dermis, where you have the reticular dermis and you have the papillary dermis. So the more sensitive side will be on top, and the reticular dermis will house all of your cells, major mast cells or immunological cells, and hair follicles and glands and nerves. So that's where the placement actually lies. So the timeline of skin engineering. It's not that skin tissue engineering is a very new concept, it's quite old, and it goes back to say 40 years and 45 years, where people have tried to replicate skin with time, say maybe the first keratinocyte culture established, or understanding the nature of keratinocyte, using it as a graft sheet, using it over patients for maybe burn patient treatment of full thickness burns, and then grafting, and then comes replaceable keratinocyte layers, then understanding the co-culturing existence of keratinocytes and fibroblasts. Then came a point where you could reconstruct all of these, right? Keratinocytes, fibroblasts, using collagen, and then we came down to maybe using most of these conventional techniques, maybe casting and electrospinning, and so many such methods where you're um, creating skin models in whatever form possible. So this is where 3D bioprinting is a next step to adding and creating more 3D structures. And when you look at the timeline, actually most of these were done on a 2D layer, right? So we first understood things on a surface layer, and then we came to realization that as we progress, we would be able to make something more 3D like, more physiology like, more anatomy like, and more phenotypical. So 3D definitely started, the idea of 3D definitely started long before this, but how to implement this was a challenge. They have implemented it maybe using electrospun methods, or casting methods, or any other basic sheet production methods. But the process would have been such that they had to seed it with cells later on. Maybe there was uneven distribution of cells. Maybe the shape of the skin wasn't fine. Using the material that they had to use wasn't providing you the right set of possible applications, and was not allowing in terms of a long-term sustainability because they lacked vasculature. So that's where, when you use 3D bioprinting, it being a form of additive manufacturing, so here the idea of using 3D bioprinting is just to create a more 3D like structure, to allow better geometrical distribution, to give it more precision while creating a model, and also using a wide range of products which were not previously being used that much. So you're using smart materials, you're using hydrogel based materials, and you are trying to create something on a layer by layer fashion to create maybe a skin structure. I know skin is a 2D sort of a flat layer structure, but there's a need for it to have multiple layers to form a 3D sort of structure. And the idea of 3D bioprinting actually came in from 3D printing and tissue engineering as concepts. And I have mentioned about the conventional methods. So essential components when it came to 3D bioprinting is, say, cells, they are hydrogels, they are culture media, and all of them together itself form this technique and allow 3D bioprinting to successfully print and create models for the work. So I'll tell you what are the steps involved, and subsequently we'll be able to understand how we are going to use these protocols or basic steps that you have in bioprinting to come in picture when it comes to skin printing. So there are a lot of factors to consider while doing it. So we will start with that. So for example, we would use any basic data, right? We would use a data which is already existing for us to consider it to be used. It is again a 3D form, it requires a certain geometry, we need to know a design, we need to know the anatomy. So the anatomy is something which we just went back to when we understood that it has three main layers. Each layer has their own subsequent layers, they have their own structures and dimensions. So the anatomical data is one thing which you could refer to when creating a basic model. Then comes maybe MRI or CT scan. So MRI or CT scan will give you, if it is something which is more in detail in terms of skin, I believe it wouldn't be the most efficient required or the most required data. But on the other hand, you could use something like 3D scanners. So we have something called an Arctic 3D scanner, which is easily able to capture the the surface texture, the surface topology, and other factors, the geometries and the end curves, the edges, the ridges, for us to design a model which is able to replicate it in the most natural, in the most closest form. So this whole idea, this whole step would be imaging as a first step of bioprinting. Following that comes a 3D design. So whatever images we have, whatever data we attain, will either be directly in the 3D form or it will directly be in the 2D form, and it needs to go through a step of processing. It is digital data which needs to be converted into a 3D CAD model form. So maybe called as an STL form. And this 3D design is the one which is going to help us make the main blueprint for what we are going to print. And while we have done the 3D design, we have to do some changes in it. Example, you want to create a solid block, but there are many ways to fill a solid block. You can fill it either with parallel lines all across the cube, or you can have continuous lines being filled across it. So this idea is the infill density that we use, and infill density is something which is crucial in terms of considering the mechanical aspects and considering the shape fidelity, as in the structure retention, and also in seeing how well is your structure actually formed. Post this, you have design, and for the design you would consider again these aspects. And while you're doing the design, you also have to check the STL being converted to a G code, because in the end, this is what's going to help in say understanding what is the path taken by the machine, and understanding what distances, what time, what is the speed, what is the height of printing, and all other factors to consider. So while you're doing this design, there is also testing, there's also checking and understanding what could be the possible dimensions you can use in terms of making the infills, in terms of making the height, the first layer height, the last layer height, if you want to introduce any sort of gradient in terms of fills. So from the design, we go down to the material selection. So when we are talking about skin, we know that skin could be of 3 layers. Okay, they are going to be a flat line surface. They are going to be 3D, that is adding many layers to them. We also know what could be the infill density of filling that skin. The next step is going to be selecting the material. Selecting the material in terms of process is very crucial, because if you're using materials like collagen, if you're using materials like gelatin, you have to be very safe or very vigilant while using it, because these are materials which can easily break. They have a swelling ratio, they have maybe external factors that could contribute and affect the growth of your skin tissue. So you have to optimize, modulate, and characterize whatever material you're using. Mostly used materials when it comes to say skin production could be collagen, could be gelatin, could be alginate, in very rare cases chitosan as well. And you sometimes have blends of two different materials just to make the skin structure more mechanically robust. So with the material selection, you also have a second part of the main part, which is cell selection. If I'm taking about or thinking about using it in the application of skin, right? So I have to consider the cells that I'm going to use: keratinocytes, fibroblasts, maybe stem cells if required. If I want to use that as a main precursor, and then I want to differentiate it, then I can also use blood vessels, which is endothelial cells. Now, this is all dependent on the complexity you want to attain. If you want to just create your first layer of skin, which is a keratinocytes rich structure, you can just create that and understand it, study it, then slowly progress down to understanding the second layer, the dermal layer, and in very rare cases, the bottom layer, the hypodermis, and creating vasculatures, adding complexities, making disease models, maybe adding disease cells, or introducing a sort of disease, maybe through infections. So, All of these have to be understood, have to be pre-planned, have to be considered while you are trying to design your skin model. Every model you design has to keep your application in mind. So if I want to do a disease model, then I have to stick to the protocol saying these are the steps I need to use. But if I'm considering something like using a graft model, then I have to see what are the essential layers, what is the extent of usage, what is the degradation, and few other aspects. So this is the whole bioink development. And in this part or in this phase, you have material selection, and with the material selection being the cell selection, they both are blended together. So it is in the 2:1 ratio. That is two being the material that you're going to use, and one part being the cell rejection that you want to use. So from here, you have to decide what mode, what method best suits in terms of bioprinting. Whether it is extrusion based printing or it is DLP based printing. So extrusion based being pneumatic based printing, where there's something called FDM, fused deposit. It's filament dependent printing. It has a wide range of materials. The work that has mostly been on 3D bioprinting is towards extrusion based printing because it uses pneumatic forces. You can use multiple materials. You can optimize the materials easily. You can create the shape and structure you want to. After this, you have the DLP, which I told you, right? So DLP uses a hydrogel material which has to cross-link or photocure with a specific light, a specific photo initiator which is added into it, and then it will create high resolution structures for you. It will create something which is very detailed when you are talking about creating some main models. So, among extrusion printing and DLP printing, usually it is the extrusion based printing which is most used when it comes to skin bioprinting. And as curing or the post printing process. So this is where cross linking takes place, and with the cross linking, you use a light of a certain density, maybe 405, 365 nanometers, and you try to solidify. So the idea behind curing is to solidify the structure which is being printed. I have used a certain material which is in a very jelly like viscous format. I wanted to be a little more solid comparative to it was. So while doing that, you need to consider the gelation temperature, maybe the temperature at which it's printing, the temperature it needs to settle down after it prints, what is the environment it needs for it to solidify. So you have maybe chemical cross-linking, you have light-based cross-linking, you have temperature-based cross-linking. So you can consider and choose what you want to use the best. So after this, the incubation phase. So incubation phase is the phase where the whole growth process happens, and you have to understand that while you're doing all of these processes, you have to be very sensitive of the environment. So having an aseptic environment is crucial. Temperature, humidity, levels of oxygen, levels of carbon dioxide, all of that is very important. So in the incubation, you would usually start from say day zero, go on testing throughout the days with the cell viability to see how well the cells have grown, what is the production. You want to do live dead assays, you want to do any sort of biochemical marker studies, you want to do any chemical studies, all of that will happen as you do the incubation, and it will go maybe 4 weeks or beyond 4 weeks, or to some extent 2 weeks, but generally it's a 4 weeks time that you consider. So this is the maturation phase entirely, and this is what helps forming your cells or maybe cell spheroids, or structures of cells arranged together to form a tissue structure. From this, we come down to the in vitro testing. So in vitro testing, you maybe would want to do mechanical tests. You would want to do any sort of uh, live dead studies. You want to see the nature of two types of cells together. You want to do your drug testing. You want to see the impact of a certain drug. You want to do the toxicology study. So all of these can depend based on your applications, and this is the final step. These are again the broader sections, and each section of them requires their own study. Maybe material selection, maybe cell selection, maybe using the type of printer, understanding what sort of curing time, understanding the whole cell culture ideas, understanding how you should do this whole process together is very crucial. So I will now take down a few examples, a few cases. Here again, it is engineered infected epidermis model for in vitro study of pro-inflammatory response. So they have just taken the epidermis for them to understand the effect of an infection or to understand the wound healing capabilities. These are models in terms of research aspects for them to understand most of the processes. So here they have used a gelatin-based epidermis model, wherein they have definitely used the keratinocyte cells, and they have cultured it. They have gone through the processes which I've told you in this slide, and they needed to test. They needed to first prepare and create a 3D structure. So first being in this scenario, they just poured down gelatin into a base, and into that they used pluronics, which is a support material, temperature material, and they try to print that all through the surface so that they can create a vasculature structure. So they did that, and over that again they put gelatin, and they wanted to see how you can artificially first create a vasculature and also create a long lasting model of skin. So gelatin being a material is tested for the mechanical aspects, the swelling ratio, the degradation time, the compatibility, the mechanical strength, and few other aspects. So this is incubated, and then you do the testing phase, right? So the incubation again for skin requires an air liquid interface, because if you see that we have our skin, one of it is air and the other of it is your liquid being blood or any other fluids within our body. So it is also to be cultured in such an environment, and that is what is going to help in arrangements of the cells over the layers of skin. So, with the tested model, they were able to see quite a structure where they could see the permeability of the drug. If they had to test a drug, they would see the efficacy and also see the layer penetration of any sort of drug. So, if you do this sort of study, you will be able to understand and correlate what is the extent of drug penetration, what is the efficacy of the drug you're using, and also what can be improved in the drug that you're creating. Maybe the molecular size, maybe the it will also help us understand the junction of the skin structure. What is the whole structure actually, the lipid molecules, or the cell arrangement, or the kind of layers that have been found. All of these studies are carried out subsequently, and they can help in doing those. You would do the scratch wound healing, you would do infection growth test. So example, if you've created a scratch and you have a component called HACAP, which is available on the keratinocyte layer, you want to see what is the extent of wound healing in the next few days. You would also want to see how using a medication, right? So mostly it is the antimicrobial medications that you would use when it comes to wound healing. So you will try to test um, the infection growth. Maybe you can induce an infection by using any sort of microbe, say Escherichia coli or any other sort of bacterias, and you would use any ciprofloxacin sort of medication, and you would test them in different environments. Say one with just your skin model, one with your infectious growth along with the medication, another one with your infectious growth without with the medication. So you will have this sort of comparative study, which is your group 1, group 0, group 2, your placebo section and your general section, where you're comparing what best suits in terms of creating this. So this is in terms of creating a very simple epidermal model, and it usually starts with that. It goes with the epidermis, Then you add your second layer, which is your dermis, and then you go down to the third layer being the hypodermis. So most of the work is usually limited until the dermis layer. Again, adding complexity to the dermis layer, maybe having melanocytes in the epidermis, having your Merkel cells or Langerhans cells, adding maybe sebaceous glands, trying to add hair follicles. All of these are controlled with time. So then comes 3D bioprinting, right? 3D bioprinting of skin with vascularized perfusable skin. So whatever models are created in general, they are flat in structure, yes. They do not have vasculature if you're using any other method. Vasculature in this case would be prolonging the lifeline of your model, and also to create a sustainable model. I want this model to be used on a patient, or I want this model to be tested, but I need the life duration of that to be prolonged. That's where having vasculature for any type of tissue is very crucial. May it be heart, may it be skin, maybe it is liver. But now depends on what complexity you want to achieve, what is the number of cells you want to use. Is it multicellular or single cellular? So with skin, here they have tried to create a basic model of skin. They, created a novel bioink, where say they have leveraged a cooled print head to print out a novel bioinks. So creating a novel bioink is one process when it comes to even creating skin models, and then using that ink along with your studied cells and then printing your skin will be the main idea of the process. So there's a potential, to overcome the limitations of graft survival when you're using these, because eventually we have come down to using patients own cells or maybe autologous cells being used. um, Autologous being general and allogenic also being other type of cells which are used. So using the patient own cells will also be a future plan for the commercial as well as the research aspects in terms of precision, in terms of cosmeceuticals or any other aspects. So the cells were grown, they were created, and after printing, they would do the tests for day 3, day 20, try to understand what is the arrangement in a span of time, and see what is the growth. So the printing scheme is creating the dermal layer first. So you would prepare and load the bioinks into the printer, into the bioprinters. Then you would print the layers of dermal bioink. So when you're printing the layers of dermal bioink, either you can just first create your layers, and then you can create droplets of the cells you want to have a better cell arrangement in your aspect. So you can use droplet based printing, or you can use syringe pump printing to just put the cells in their specific places, do this process layer by layer, incubate the whole structure, understand what is the growth that has happened in the dermal bioink or in the dermal layers, and then come down to printing the epidermal layers over it. So it's a time bound process of incubating the first layer, then printing the second layer over it, the topmost layer over it, and understanding how this goes about with time. So printing vascularized perfusable skin has led to creating artificial human 3D bioprinted skin, and you would do a comparative studies between your foreskin and your bioprinted skin, human foreskin. So you'd see the histopathological aspects where you're seeing the arrangements are quite similar. The amount of filaggrin, the amount of CK14, collagen 4, CK10. So yes, it is not very, very, very similar to the foreskin, but it's quite similar in terms of having the cell arrangement, having the kind of texture required, the layers required. So that way, 3D bioprinting becomes a very important, essential, and easy technique in terms of mass producing skin, in terms of testing skin, in terms of creating geometries which are crucial for creating it. So I'll play this video which will give you the process or how it actually looks like when it comes to producing skin in a laboratory. First step would be setting up the machine. So all of this is done in a laminar flow chamber. So you go with testing your material. Right, so you need to do the flow aspect studies. Use a petri plate here, calibrate the printheads. They've made basic layers of the dermal layer being first. Then the pressures again can be regulated with the printing process. So the cross linking is dependent again on the material you use. Here, Cellink itself has a kit which is meant for skin bioprinting. So they have thrombin solution, they have Cellink skin as a material which consists of the fibrinogen, fibrin levels, which is modulated in it, so that can help in terms of wound healing studies or any other form of study. So this is just basically following the protocols that take place when it comes to printing a model. And now is the incubation process. Cell viability and morphology study takes about 14 days. So that's about how you could, bioprint with skin. And I will just tell you about a few of our solutions, give you a brief idea of what we have on store with us. So we have Incredible Plus. Now these are basic model machines. BioX 6, slightly complex, say in terms of multiple print heads, in terms of replaceable print heads, better temperature controls, print bed temperatures, environmental controls. Then we have BioMDX, which is an industrial grade machine, which is meant for mass production, liquid handling, QS studies, basically quality regulation studies, etc. And then we have Luminex, which is a DLP based method for printing and creating complex models. So this adds on to the Cellink, bioprinter product portfolios that we have with us, and I think we'll keep on adding more products. There are also more that you can visit and check on Altem Technologies, our website, to get any details in case you want to know anything about it. Um, then we also have the BioVia, which I've mentioned about, and it's uh, biological modeling and simulation software. And here, it is a 3D protein engineering biological design model, and it allows in visualization, in simulations, antibody modeling, toxicology understanding, like in the ADME studies and predictions, analysis, visualizations, and they're used quite widely in bioinformatics and cheminformatics as well. So this is a wide range of where they can be used. Maybe virtual screening, structure and fragment based design, then ADME toxicology, molecular dynamics, and simulations. So thank you so much. So I end the session, but before that, I will just tell you about uh, our Q&A session, or our Q&A that we have. So the question is, which among the layers of skin can be easily replicated? The options are hypodermis, dermis, epidermis, and vasculature. So you need to know which is the easiest one, and you need to give this answer. So we will not be posting this on our website. So I'll just tell you the rules. I'll recite the rules to you right now for everyone who's watching. Um, so you have to read them thoroughly. So all of the questions have to be considered. So we have maybe four or three questions, which we'll have today being the first bio quiz question. You need to answer in the comment section, you know uh, which is on our LinkedIn profile. You will have the question there, so you can just answer there. You have to subscribe to our YouTube channel, share this video on social media, and with that you will be able to, or we'll be able to shortlist somebody, and we'll be announcing the results after the 5th of October, which is after our final series session when it ends. So the winner, the person who wins, would get a 2000 rupees gift voucher from Amazon, again keeping in mind that you have all of these ticked mark and you have answered all of the questions well. So thank you. Now we can proceed to the Q&A session, and kindly follow us on LinkedIn. You can definitely get in touch with any of us from Altum Technologies. You can understand more. If you have anything, you can always mail any of us, and keep sharing this. Keep sending this across to people who you think it might find interest and find it useful. If uh, it is the biological healthcare sector, we have not only the life sciences, but we also have other aspects which you will come across when you visit our LinkedIn profile. So thank you. So we'll go to the Q&A session right now. Okay, so let's see. Does anybody have questions? I'm just scrolling through to find some. Okay. Are the media used in 2D and 3D culture different? As in the 3D culture, there will be need of multiple growth factors which may not be needed in 2D culture. Yes, there will be a difference. Now, this would be dependent on what sort of what sort of cell form you're using. So if you wanted to use a differentiated cell, then you will have to use the respective differentiating factors to do that. The normal culture will definitely require your basic DMEM, your antibodies, so your antibiotics. You require your serum content and everything else. The 3D culture medias will just require the differentiating factors that you require to trigger a certain type of biochemical that you want to test. So yes, there will be some amount of difference, but ideally the main structure is that. Okay, so there's this other question which I see. How about the adherent cell cultures? Can they also be printed? So when you're using bioprinting, actually the idea is to use spheroids. Spheroids is basically a clump of multiple types of or multiple cells all put together. And when you have that, they create a sort of 3D framework. So these 3D frameworks will only help retain the structure, allowing better cell growth in providing the 3D printed scaffold if you want. So they also have better communication, and with the arrangement of how the cell spheroids are created, say round or hexagonal or even sometimes flat base, you will see quite a lot of difference. So the adherent cell cultures that we have are completely cultured in the tea flask, right? So the way of culturing spheroidal structures are a little different. Is you use a different type of culture dish itself. Um, they are called Kugelmeyer's spheroidal culturing setups, which is available on our website as well. You'll be able to see what is this design, what is the structure, why it is better than just using direct adherent cells. Okay. This other question which says which bioink is used in 3D skin bioprinting. Bioinks are various. So the one which we showed in the printer, right? While I showed you the process, consisted of something called Cellink skin, and it's made of materials like cellulose. It's made of sodium alginate, and they also add in fibrin or fibrinogen in it. So this will help you create a sort of smart material in terms of mechanical and other aspects put together. Um, and we generally use materials, if you're talking about the general study which is done using skin, you can use materials like collagen. So we have quite a wide range of materials, say collagen 1 material, we have gelma material, gelexa material, we have alginate based materials, and also just plain standard inks as well as advanced types of inks if you want to go for something specific to skin. Okay, so this question about how much cost for 3D printing per sample. This is first thing is you will always have an initial setup cost, which needs to be considered. But in terms of creating a per sample cost, it is all dependent on the material production, basically the bioink you're using, the cell methods. So you can see this all depends on the rate of production, the amount of bulk you have produced, and a lot of factors contribute to it. So me giving a specific cost will not make sense. So yes, it will definitely be cheaper than your graft methods that we use in terms of using it for surgical needs or any other clinical forms. Okay. Uh, Another question is 3D bioprinting available in India for research on cancer treatment? So, yes, a lot of people are working towards using 3D bioprinting in terms of understanding the co culture as well as the culture structures of uh, of your cancer cells. They induce cancers as well on existing models to see the effect of certain drugs on them. The adaptiveness of 3D bioprinting in cancer treatment is a little slow because it's a very complex process. But people are definitely trying to create models, co-culture models, to understand cancer metastasis better. So, are there any more questions? So, if there are no more questions, I will end the session in some time. Before that, please visit our LinkedIn, our LinkedIn channel. Follow us there. See our questions, and also you can definitely get in touch with our team, with me, if you have any doubts, if you want to know about the machine, the technical specifications, or anything else. So, thank you so much. Share this with everybody who needs to know this, and have a very nice time. So the feedback form also, I guess, is being put up here on the comment section, and you'll be able to tell us if we need to improve better, we need to add more topics, and we'll work accordingly. Thank you so much. Have a very nice day.